for technical problems that we have, and then for the delay in the start of this lecture. Today, we have the privilege of hearing from Dr. Ken Ong, PhD, MHS, a postdoctoral research fellow and teaching fellow at the Department of Epidemiology, Harvard T.H. Chan School of Public Health. Dr. Ong's expertise in neglected tropical disease, or NTDs, and malaria places him at the forefront of global health research, and his on-the-ground experience in the Lao People's Democratic Republic, or Laos, have made significant ground experience in the contribution to the understanding of neglected tropical diseases and malaria. Those are the two critical health issues that disproportionately impact vulnerable populations in Southeast Asia and beyond. This might provide a unique lens through which we can better understand these issues. For those unfamiliar with the term neglected tropical diseases, or NTDs, I think Dr. Ken Ong will talk about it in more details. But for an example, it's schistosomiasis or filariasis that we haven't heard later a lot. Yeah. And malaria, although not classified as NTD, it remains one of the world's deadliest vector-borne diseases. And like NTDs, it disproportionately affects low-income communities in tropical regions, as in Indonesia. And Dr. Ong will draw from his extensive fieldwork in Laos, where malaria and several NTDs persist as public health threats. Given the similar epidemiological context in Indonesia, his reflections will provide critical insights for our own efforts to combat these diseases. And this lecture is an opportunity for us to explore practical solutions, innovative research, and cross-cultural approaches to public health intervention. On behalf of the Faculty of Public Health, I would like to express our deepest gratitude to Dr. Ong for sharing his time, knowledge, and experience with us. And we hope that his insights will not only deepen our understanding of NTDs and malaria, but also inspire action to strengthen Indonesia's own health initiatives. And without further ado, please join me in welcoming Dr. Ong for his lecture on neglected tropical diseases and malaria, case studies from Lao People's Democratic Republic. Thank you. Would you like to say actually? Yeah. Where are the slides? You can check them. Yeah, we have them, right? Yeah. Sure. Sorry for the technical problem. I have to stand here. Okay. Or if possible, can you quickly ask the audience to move back here so I can talk to them? It's so far. Yeah.
All right, good afternoon, everyone, and I am so sorry for the delay, and I'm really thankful for your time here for my lecture. And my name is Ken Ong, and I'm from the Department of Epidemiology, Harvard T.H. Chan School of Public Health. And today I will be talking to you about neglected tropical diseases and malaria, and focusing on case study from Laos People's Democratic Republic. And let me briefly introduce myself because I think you might be curious who am I? So I'm a Malaysian by nationality, but I grew up in Thailand and I went to Japan for my undergraduate and my master and also my PhD. And during my master's, that was where I met Dr. Rizka Maulida, Bu Rizka. So we were in the same year and we started the master's degree together. And after I got my PhD, I also worked as an assistant professor for 5 years at the University of Tokyo. And I also had the privilege to mentor many amazing students. And one of my students is actually in the audience here, Jun. And he's actually the expert on NTDs in Indonesia. So if you have questions about NTDs in Indonesia, you might want to ask him and not me. Okay. And so after working as an assistant professor in Tokyo, I moved to the Harvard T.H. Chan School of Public Health, and I've been there for about 2 years now. And so most of the work that I did in Tokyo was in Laos People's Democratic Republic on malaria and neglected tropical diseases. And before I, go any further, I have to acknowledge my colleagues there, Dr. Moritoshi Iwagami and all the other Lao colleagues, because I'm not a Laotian, I am an outsider. And for me to be able to conduct research in Laos, I really these people really helped me a lot. They taught me a lot about the local context and the local culture, and I think it's appropriate for me to acknowledge them before I share the work that I did because it's not possible without their help. All right, so most of the work in Laos, I did some lab work with the Pasteur Institute in Laos, and also I did a lot of field work, where I go to rural areas to collect blood samples and also to interview villagers just to learn about the situation of the malaria and neglected tropical diseases in those areas. And I was also given the opportunity to provide some capacity building training to the local staff in Laos. And at Harvard, my main duty is teaching. And so I teach mainly epidemiology and public health for a special program called the Mississippi Delta Partnership Program in Public Health by the Harvard T.H. Chan School of Public Health. And most of my students, they are undergraduate students from the southern states of Mississippi and the surrounding region like Arkansas, Tennessee, Alabama. And the purpose of this program is to train the next generation of public health and also problem solvers in the southern United States. And so I do a lot of teaching back at Harvard Chan. And actually, this trip is very special for me because it's been the last time I came to UI was 10 years ago in 2014. And I haven't been back here for 10 years. And when I was when I was here 10 years ago, I was given the opportunity to visit a village called in Karawang, West Java, with a team from the University of Indonesia. And so I'm really glad to be back here again after 10 years. And since I understand that the audience today are mainly undergraduate students, and so I will not go into detail, too much technical details about malaria or neglected tropical diseases. And what I want to achieve today is to provide you a basic picture and maybe some ideas and some key takeaways that you might be able to use in your own research or your own studies. All right. So this is supposed to be a poll where you can take the QR code and answer the poll, but it doesn't work here. I don't know why. And so I just want to ask all of you how much you know about malaria or neglected tropical diseases. If you know a lot, just put your hand as high up as you can. If not, then maybe here, or if you don't know at all, Just don't have to put your hands up. Can I see the audience? Okay. Oh, I see some hands. One or two. Okay. So you don't know anything about malaria or neglected tropical diseases? No? Okay. Okay. All right. No worries. So I hope you will learn something today. Okay, so what are neglected tropical diseases? So neglected tropical diseases or NTDs, there are a group of about 21 preventable and treatable diseases. So I think these are the two keywords, preventable and treatable, that mainly affect people from the lower socio-economic group. Okay, and about 1.6 billion people are affected by at least one entity worldwide. And if you look at this figure, it's 1/5 of the world's population. And some of the NTDs you might already be familiar with. They're like dengue or leprosy, lymphatic filariasis, foodborne dermatitis, or soil-transmitted helminthitis. All right, and NTDs can cause permanent disfigurement. For example, diseases like leprosy or lymphatic filariasis, it can cause permanent disfigurement. And because these diseases, they affect mainly people from the low income group, this could affect their productivity. No, they are not able to work because of the NTDs, and this can perpetuate the poverty cycle and also the stigma against the people living with NTDs. And as for the NTDs in Indonesia, so like I said, I'm not an expert, but I'm just going to give you a brief overview. So last week, I had the opportunity to visit RTI office where Mr. Ahmad Junaidi works, and I was told that there are about 11 NTDs that are endemic in Indonesia at the moment. But earlier this year in March, the Ministry of Health targeted 5 NTDs for elimination, and these 5 NTDs are lymphatic filariasis, schistosomiasis, soil-transmitted helminthitis, yaws, and leprosy. So these are the 5 main targets by the Ministry of Health of Indonesia. And as for the progress in Indonesia, so I'm sure all of you know what SDGs are, right? Because you're in school of public health, so you should not say no. Okay, so the World Health Organization's target for NTDs and malaria, especially indicator 3.3.5, is a 90% reduction in the number of people requiring intervention, which include treatment or care against the baseline from 2010 data. And so if you look at the progress in 2022, so the percentage reduction achieved is about 50%. So when you look at the figure, it really depends on if you're a positive or a negative person. You can look at this as like the cup half full or the cup half empty. But for me, I think I'm a positive person, so I think this is a cup half full. And I'm not sure if Indonesia would be able to achieve the target by 2030. We don't know, but let's remain positive. We still have 6 years to go until 2030. So it really depends on all of you. You're the future of the public health of Indonesia. So okay. And right now, I want to focus on a specific group of NTDs, which I work a lot in Laos, and these are called foodborne infections. And you might already guess that because of the word food, you get these NTDs because you eat some food that are contaminated, and that's how the parasite enters your body. All right, and some of the parasites are Opisthorchis, Clonorchis, Fasciola, and Paragonimus, and these are all very fancy names, so you don't have to worry about that. But prolonged infection with these parasites can really result in severe liver disease, like liver cancer or the bile duct cancer or severe lung disease. And if you remember in the past few slides, 1.6 billion people are affected by NTDs. That's about 1/5 of the world's population. But because this group of diseases are neglected, there's actually very little data on the prevalence and on the incidence of these diseases, because not many researchers are actually doing some work on these diseases. But in Laos, the prevalence of this liver flu or opisthorchitis was reported to be about 80% in some villages. So about almost everyone is infected, right? And again, the key word for NTDs is they are treatable and preventable. So treatment and prevention is available. Okay. And so this is liver fluke or opisthorchitis. You don't, if you have not heard of this before, that's okay. Because this disease is very specific in the Greater Mekong sub-region, only especially in Laos and northeastern Thailand. And you get the disease by consuming raw fish. If you look at a life cycle, so this, I don't know, maybe it's the camera angle. It might not look very tasty, but this is a very famous raw fish salad that is consumed in Laos and in northeastern Thailand. So it's raw. And people get infected with the parasite by consuming raw fish. And then the parasite goes into the body and you release the parasite through your feces. And if you have proper toilets, like what we have here, in Jakarta or on campus, it doesn't matter. There's a proper sewage system. But in many rural areas in Laos, you don't have a proper toilet. So whatever you release, it goes into the natural water sources. And after the human release the parasite, it goes to the water snail. So it will infect the snail first. And then from the snail, it goes to the fish and then back to the human. So this is a very complicated life cycle, right? It's not that simple. It involves snail and fish. So this is a liver fluke. And this is the Greater Mekong sub-region. So the Greater Mekong sub-region covers countries like Myanmar, southern part of China, like Yunnan, Zhuang Autonomous sub-region, Vietnam, Laos, and Thailand. And like I mentioned before, many of the data on these diseases are very scarce, very little. And so most of the time, the researchers, they would do, calculations, projection, modeling, or meta-analysis to get the prevalence. And so this was taken from a systematic review. And as you can see, and the Greater Mekong sub-region is called Greater Mekong sub-region because the longest river in Southeast Asia flows through that region from the Tibetan Plateau, right, all the way down to China, Laos, and then to the Mekong Delta in Vietnam. And as you can see, Laos has the darkest color, and it's said to have like the largest burden of this disease, about like 34% of the pool prevalence of OV infection. And so, knowing the life cycle, knowing how the parasite is being transmitted, and from human to snail to fish. So having this information as a public health practitioner, what would you do to stop the spread of the disease? Anyone? Oh, yes. Looking for data? Mhm.
So, as a public health practitioner, the first thing that we need to do is actually gather data, which is gained through like surveillance system, and it depends on like the health system of each country. Like for example, in Indonesia, we have like Puskesmas. Like we could use those places to actually gather those data because they cover a certain area, which would be more precise, I would say, compared to going, from like a national level, which is not as precise as like the Puskesmas area. So the first thing I would do is gather the data and then move on from there.
Okay, so gather data and work from the community level. Okay, yeah, that's a great answer. Any other ideas as a public health, the future of public health of Indonesia? Having this information, what would you do? Okay, no problem. If you if you want to answer in Bahasa Indonesia, that's also okay. But yeah, just feel free, to talk. So I hope this will be an interactive session. Okay, yep. So that's right. Gather data and also work from the community level, right? And so when I was training as a PhD student, my mentors, they always remind me that if you're focusing on infectious disease, try to look at the life cycle because the life cycle goes from one organism to the next. And if you can break the chain, somewhere in the life cycle, then that will actually stop the parasite from going or spreading. And so this is an example from the northeast Thailand, the Khon Kaen province, and done by a group from University of Khon Kaen. And they use One Health or the eco health approach. And I'm sure many of you might be familiar with this concept. And so if you look at that life cycle, um, the the researchers, they try to break every single part of the chain. So they have efforts to break every single part of the chain, right? So the first one from, from for the human. So they started like health education. They educate people that this type of food is risky, don't eat it. And they have the medication, and for the sanitation, they build proper toilets or latrine for the people so that if the human defecate, it doesn't go into the water sources. And it because it involves snail and also fish, they also bring in biologists or ecologists, so they bring in everybody that is involved. And this model was very successful since it started in 2007. The prevalence reduced to less than 10% from about 60%. So this is a very successful figure. And as you can see, it started in 2007, and you might have guessed, like any public health interventions or campaigns, it really takes time. And if you want to go into public health, you need to have the patience because you can't see the result just overnight or in a week or in a month. It takes time. So if you are a patient person, then you can do public health. If not, maybe think again. But yeah, that's what I'm trying to say. If you want to see the health good outcomes for public health, it takes some time. Okay. And so back in Laos, we were not able to do such a big project, but we were able to contribute something to the knowledge base. And uh, based on our research, so when we asked the villagers whether their children eat the raw fish, the family told us that no, they don't eat the raw fish. And so, just by looking at this information, you would think that the children will not be infected. But when we test, for the infection, many of the children were also infected, about 70 or 80%. And this is very surprising. If you don't eat the raw fish, you should not be infected, right? And so that we ask why. And when we do the analysis, we found that if the mother likes the raw fish dish, and if the mother eats the raw fish, then that's a strong predictor for the child's positive status. So we thought that was very interesting. And this research was, and I'm the second author, and this research was awarded the best paper by the Japanese Society of Tropical Medicine back in 2019. And the lead author was not able to attend the ceremony, and so I took the prize on behalf of the whole team. Okay, and so with this information, with these questions in mind, what we did was we wanted to find out more. Why is this happening? If the child does not take raw fish, then he or she should not get infection. And so what we did was we do house visits and observations to see, their eating habits and how they prepare food preparation. And in Laos, in rural Laos, if you notice, this is how the whole family get together and eat a meal. And you can see that they eat sticky rice and they eat from a common basket. So they put the rice in the common basket and they use hands to eat. And so you see, this house is also there and they have that common basket. And so, by really going into the community and do the observation based on the analysis that you have, you kind of like get the clue to answer your questions. But this is ongoing, and we still do not. The study is ongoing, and we do not have like a robust or strong evidence to show that this is the cause yet. But what I'm trying to say is that um, when you are in the field, when you really visit the place, you might get some new ideas or some clues to answer your question. Okay. And so if you have not been listening to me since the start, that's okay. But these are the main messages that I want you to take home, at least. So the key takeaways from this portion of the lecture is that community involvement is important in public health work, right? And as an epidemiologist or a biostatisticians, we like numbers, we like data, but sometimes the data cannot tell us everything. Right. So numerical data alone is important, but it might not tell us the whole story. And so system thinking and field epidemiology skills are actually very important if you want to study infectious disease epidemiology or neglected tropical diseases. So these are the key takeaways that I hope you would take away with you after today's lecture. Okay. And now let's move on to malaria, right? So humans get malaria if you're being bitten by what insect?
Mosquito.
Mosquitoes. Okay. I'm just testing you. Okay. Okay, so this is a general background of malaria. And so there are many different species of mosquitoes, and there are also many different species of malaria parasite. And there are 5 major malaria parasites that affect human. So the first one is Plasmodium falciparum, and that parasite actually is the main culprit that causes the largest burden in sub-Saharan Africa and also in Indonesia and other countries. So that's the main parasite. And then the second one is Plasmodium vivax, and the other 3, ovale, malaria, and nullicide, they are not so major. But Plasmodium vivax, the second parasite, and Plasmodium ovale, they are very unique because they have a special stage in their life cycle. So once you get bitten by the mosquito, vivax malaria can actually go to your liver and it just stays there and do nothing. And maybe after a few weeks or a few months, suddenly you get malaria again. The parasite decides to wake up, and in certain cases, a few years, you just suddenly get malaria, even though you do not go to the forest or you do not go to the malaria endemic area. And so Plasmodium vivax is very special because it can just stay in your liver and do nothing. And I don't know. Yeah. So, yep, that's vivax. And as for the global situation of malaria, I'm not it might not be clear, but you might know that the largest burden is in sub-Saharan Africa. So as of 2022, 249 million malaria cases and 608,000 deaths were reported. And this number actually increased after the COVID pandemic. So, COVID pandemic just makes everything worse, and even for malaria the number increases. So we were actually making progress, but after the pandemic it goes up again. Okay. And for Indonesia contributes about 1,156,000 cases, and that's actually a lot, right? I mean, 1 million cases. And most of the cases in Indonesia are actually reported from the eastern part, like the Papua and those eastern islands. Okay. And now back to the Vivax malaria. And so if you have Vivax malaria and you might have a parasite in your liver, how would you feel? you don't feel good, right? Because you know a parasite is living in your liver, and you know, for me, I wouldn't be able to go to bed at night knowing something is living and hiding in my liver. But fortunately, there's an effective medication for Vivax malaria, and it can kill the liver stage, and that is called primaquine. But in public health, nothing comes easy. So you have the effective medication, but not everyone can take the medication. If you have a condition called glucose 6-phosphate dehydrogenase deficiency, which is a very long and fancy name, but it's actually an enzyme deficiency condition that if you have it, then you are more prone to get hemolysis. So this enzyme, all of us have it. It protects our red blood cell from oxidative hemolysis. And if you, for example, if you take drugs or some other food, then you know your red blood cell might burst. But if you have this enzyme, it helps to protect your red blood cell. All right. And for glucose 6-phosphate dehydrogenase deficiency, this condition is actually the most common enzyme deficiency in the world. About 500 million people have it, right? In certain countries, you get tested the moment you were born, but it's not done in many countries, okay? And so if you have this enzyme deficiency, you should not take the primaquine. And also to make the matter even more interesting, the glucose 6-phosphate dehydrogenase deficiency is very common in malaria endemic area. So, and there's actually a reason. So many studies have been done to show that this enzyme condition, they evolve together with malaria. And so, you know, yeah, that's the interesting thing in public health. You always have challenges and challenges. You know, if you want to solve something, it's not easy. Okay. And so a very brief general background. And so is a classification by the World Health Organization. And if you are classified as class 1, you have very severe deficiency. So you should be very careful with the medication that you take or the food that you eat. And class 2, class 3 is enzyme activity is less than 10% of normal. So class 4 and class 5, you can consider them as normal. Right. And so in Laos and Cambodia, the most common variant is Vientiane and is class 2. So the enzyme activity is actually less than 10% of the normal activity. Okay. And so, you know, knowing this information, so our team realized that, you know, even though that this enzyme deficiency is very common in malaria endemic area, but there's a lack of information from the greater Mekong subregion, right? There's not much information this G6PD deficiency in the greater Mekong subregion. So what we did was we did a systematic review. We review all the clinical reports and publish reports. What are the major clinical manifestations? And the major clinical manifestations of G6PD is hemolytic anemia or hemoglobinuria, and it also affects the clinical presentations of other common infectious diseases like typhoid fever and dengue fever in that area too, right? And so this was the first work that we did for malaria. And having this information, the next question that we ask is, we know that G6PD Vientiane is common in Laos, but then again, there's not much information of the prevalence of this deficiency in the country. And so our team, in the collaboration with the Ministry of Health of Laos, we did one of the first studies to screen for G6PD Vientiane on a large scale in the whole country. And so we selected 3 places from the northern part, in the middle part, and also the southern part. And what we found was that the prevalence ranges from 1% to about 12%. So there's a range of the deficiency in Laos. And by the time when we were conducting the study, there was this Lancet commission, and they say that malaria they this group of researchers, they want to eradicate malaria by 2050. And so, do you know the difference between eradication and elimination? So, eradication means, so I'll explain it in very simple terms. Eradication means you get rid of the disease globally. That means anywhere you go in the world, you won't find the disease anymore. But for elimination, it's more of a specific area, right? Like you eliminate malaria from Japan, so there's no more malaria in Japan, but malaria still exists in Indonesia and Laos. And just a quick questions. There's only one disease that has been successfully eliminated. One human disease that has been successfully eliminated from the world. Does anyone know what disease is that? Okay. And anyone? So if you answer, maybe give chance to student. If you are able to answer, I have a pen from Harvard. Yes. Polio? No. Smallpox. You're right. Okay. Here you go. All right. Maybe this will encourage you to answer more questions. All right. Yeah, but smallpox is the only disease that has been successfully eradicated, right? And it's only one. And so, there are just so many diseases in the world, and this might tell you that eradication or elimination is not an easy job, right? So it's very difficult. Okay, and so this group of scientists, they want to eradicate malaria by 2050. Again, it really depends if you're a positive or a negative person. So whether or not this is possible, we don't know, right? And 2050 is still very far away. Okay. And so, based on the work that we did, we know that malaria elimination. So there's a target to eliminate malaria from the greater Mekong subregion by 2030. And to achieve this target, we need primaquine, right? Because we don't want, the Vivax malaria to just stay quiet in the liver, and one fine day it just starts to come out from the liver and, cause problems again. And so primaquine is necessary. However, you know that G6PD deficiency is also common in that region. And if you want to prescribe primaquine, you need the G6PD status assessment. If not, the patient would get hemolytic anemia, and this could cause death in severe cases. And what does this tell you? And so in Laos, many malaria endemic areas are in very hard to reach areas, very remote areas. And you can see the first photo, we were going to a village in Laos, and this was in the dry season. And in the wet season like this, some villages are actually cut off because the roads are flooded. And so, if there's any medical emergency, God knows what will happen. So it's impossible, right? And so this really tells us that, if you want to introduce this medication in the village, you really need to look at the quality of the healthcare, whether or not they are ready to prescribe and to, handle emergencies. Okay. And so the next step, what we did in the study was we wanted to see whether or not the villages or the, health centers, they are ready, and what is the quality, or what is, what is the health-seeking behavior like in those villages. And what we did was we used mixed methods. Like I said, sometimes in public health, just looking at numbers doesn't tell you the whole story. So we complemented this method with a quantitative method, interviews, and in-depth interviews and focus group discussions. And this is the study diagram. So we interviewed both villagers and healthcare workers. And we chose a village in central Laos for this. And we did both quantitative and qualitative study. And so these are the main findings that we have. And so the first thing is that knowledge of the people on malaria transmission was still mixed. So just now I asked you, you get malaria, you know that you get malaria by being bitten by a mosquito, right? But some of the villagers, they when we interviewed them or when we did survey, they told us that they think that they would get malaria by drinking dirty water. And so this is actually very important, right? If you do not know that you get malaria from mosquitoes, then you wouldn't care to protect yourself from getting malaria, right? You wouldn't care to sleep under the bed net. You wouldn't care to protect yourself if you want to go into the forest. And so this, we thought that this result was interesting. And at that time, the national health insurance in Laos was still being rolled out. So it's in Laos it's called Koposo, and in maybe it's very similar to the BPJS here, the National Health Insurance Scheme. It was still being rolled out, and it was very well received by both the villagers and the healthcare workers, because when we interviewed both villagers and healthcare workers, they told us that they actually want to go to the primary healthcare center to seek help. And however, again, when we when we do the focus group discussions and the interviews, we found out that there were still many problems with the service that is provided at the healthcare center. Sometimes there's not enough medication, because in remote areas, sometimes it takes a very long time for the medication to be sent from the central area to the remote area. Maybe it's similar in Indonesia, from like central area in Jakarta to Papua, there might be quite a long distance, right? And so, these were the findings that we had from our study. And when we were in Laos, we were quite fortunate that we were able to participate in the National Health Research Forum every year. And in this forum, there are representatives for the Ministry of Health. And so we were able to share our results and, advocate for, policies change to the people from the Ministry of Health. And I think this is very important as a public health practitioner. You want to share your results. But before sharing, you just have to make sure that your result is good enough, is of a high quality, right? And so key takeaways from this section is that both quantitative and qualitative data are important, as a public health practitioner. And as a student, learning how to collect, integrate, and interpret both types of data might actually help you understand a public health issue better, right? And also advocating and disseminating your research results is very important, right? You just don't want to do your research and then just write your thesis and get your degree and bye. So, if possible, try to disseminate your results. It can be in the form of publication or conference, and this is one very important way where you can make a positive impact for the people that you're working with. Okay. And having policy is important, but making sure that the policy is being implemented is also important. Okay. And so this is the last part of my lecture, and please bear with me. So climate change and its impact. So so I'm going to talk a very, very short about how climate change can impact neglected tropical diseases and malaria. So my question to you is, how do you think climate change can impact NTDs and malaria?
There's another gift, so
Thank you. I'm Fadila Habibul Hamda from Environmental Health Concern in Public Health Faculty. And I think climate change can involve and can cause neglected tropical disease and malaria because such as temperature, humidity, and precipitation it's the some factors that influence to the life cycle for factor of malaria and dengue, such as pupa or larva can live well in the range of 24 or some, yeah.
Well,
That's, I think.
that's an amazing answer. I wish I could give you something more, but I only have a pen.
Thank you.
So that's correct. So I think what she basically said covers everything, so I don't have to continue. Just joking. So actually, we know like I'm sorry, what's your name? Hamda. So like what Hamda said, climate change can affect the temperature, the range of the temperature, and it can affect the habitat of, the mosquitoes or other intermediate hosts. But, this is what we know. But then again, for in the context of malaria and neglected tropical diseases, there's still not much data. There's still not much um, concrete data on climate change and specific NTDs or malaria. Okay. And so, yeah, this is what she has kindly shared, expanding the geographical limits. And so if the temperature increases, from like into, uh, I'm sorry, if, for example, in a temperate area where the temperature is low, and if the temperature rises, this could cause the mosquito to move into that area, and it could, cause malaria to spread. And also, for example, like rain, humidity, and also, yeah, all these factors. And it can reintroduce malaria in malaria eliminated areas. Like, for example, I say Japan has already eliminated malaria, but if, the temperature rises, or, if the precipitation or the humidity changes, and now, people are just traveling everywhere, malaria, the mosquitoes could come into a ship container, and it can go to Japan. And if someone with the parasite resists Japan, malaria can be reintroduced again. So it's actually possible. But then again, we do not really have strong evidence yet. Okay. And this is an example from Pakistan. So you can see before 2022, the number of malaria just fluctuates up and down. But after an extreme climate event, the cyclone that happened in 2022, it causes flooding, and you see the number of malaria cases just shoots up very rapidly. And so this is one example of how an extreme climate event can actually cause infectious disease to worsen. Okay. And yep, so this is the diagram to summarize what we have just discussed, like, the extreme temperature events, the rise in temperature, or the changes in humidity can actually affect the habitat, or, the breeding size of the mosquitoes or the intermediary host. And this could expand the geographical range, and it can have a worse health outcomes for humans. And so just, the key takeaway, climate change is real, and the negative impacts are devastating, right? And evidence and data on the direct relationship between climate change and entities is still lacking. So this is where, if you're interested, you can, think about, going into and contributing to providing a more robust data. And most of the work done in this area is still modeling, and, and the time to take action is actually right now, because climate change is real. All right. So that's actually the end of my presentation. And thank you very much for bearing with us for about 2 hours, even after the delay.
Hello. Okay. Okay. Thank you very much, Ken. So now we go into question and answer sessions. So anyone from the audience, do you have any burning questions or, well, you can, if you want to discuss anything about and neglected tropical disease with Ken, this is your time. You can also bisa bertanya dalam bahasa Indonesia juga. Nanti saya bantu. Kalau Ken nggak ngerti, nanti saya bantu terjemahkan. But I think he understands. Anyone?
Thank you, Constance, for the presentation. I would like to ask about the foodborne entities related to foodborne because I don't know how the program implemented. I mean, how to decide whether this area is endemic or not, and how the program implemented whether like lymphatic filariasis in one village, if like the microfilaria rate more than 1%, all the whole district will be implemented for the preventive chemotherapy. How about the foodborne disease? Thank you.
Thank you very much for your question. So for that disease that I just showed you, the liver fluke in Laos, based on the data that we have and also based on the data of different research groups, also doing liver fluke research, we can actually say that most of the people, if you go to anywhere in Laos, they will be highly likely that they will be infected. So it's very endemic throughout the country. And so it's unlike lymphatic filariasis in Indonesia, where the cases are usually focused on a certain place, right? Like maybe Sumba or in Papua. But in Laos, it's actually you can assume that it's nationwide because anywhere you go, and if you look at the data from different research group, almost everywhere is endemic because the food that I just showed you, the raw fish salad, is a kind of like a it's I don't know, like maybe soto or it's something that everybody eats. And so we don't really select a certain place for the program. And what we do is we continuously educate the people. And if you look at the health textbook in Laos, it's actually there, educating the children. But I think this might not be effective because even though you take this stance and people are still consuming raw fish, so it's still there and it's very difficult to eliminate. Yeah, and yeah, that's a challenge for us. But also another thing about this foodborne infection is that, like for example, if you get lymphatic filariasis, maybe you can see the what do you call that, the elephantitis. Maybe, do you know how long from infection to the condition?
Up to 10 years.
Up to 10 years. Okay. So it might be similar to this. So if you have that parasite in your body, and if you don't do anything about it, maybe 20 or 30 years, you would get liver cancer. And so, because the time from the infection to the really adverse health outcome is long, so it's sometimes very difficult to convince people that, to think too far. They might just say that this is delicious and I eat it every day and I still don't have any health issues, so why should I change? Yeah, so that's a challenge, and that's something that we're still working on how to really do behavior change in Laos. So Laos is a bit different from Thailand, where Thailand has more resources, and when the government really pushes the project, it can go on very quickly. And in rural areas, many people in rural areas in Laos, they are not literate, so they cannot really read and write. And so, by just educating, you need a different way to do health education. Yeah. I'm not sure if I answer your question, but thank you for the question.
Thank you. Any other questions? Oh.
Yeah, thank you so much for the opportunity. First, I would like to say I really appreciate on your presentation, Mr. Ken Ong, right?
Yes, my question on your presentation, there is a very interesting point. The key takeaway takeaways that we can take for uh, intervention the issue of tropical disease, especially in filariasis. And we know in Indonesia there is some a district in Indonesia still in endemic of filariasis. So, and you said that this is your second time to Indonesia after 10 years.
10 years.
Yes. Maybe you can share to us as me as a health promotion and practitioner in health promotion, the best practice in Laos maybe or something else that you can share to us how to eliminate the endemic of filariasis especially that we can applicate to the uh, all of district in Indonesia.
Okay. So maybe I will ask my colleague June to answer, but just to answer the first part of your question. So you asked about health promotion, how to do like health promotion. So I think there's no one answer, because like and you are asking about how to do it for the whole Indonesia. And so I don't think there's one way to do it, because as you know, Indonesia is very diverse. I'm very impressed with the diversity of Indonesia, from Aceh all the way to Papua. You have so many different ethnic groups. They speak different languages. They have different religion. And so, these are very important factors that you really have to think about when you do your health promotion. You really need to understand which community that you're working with. Like for example, in Laos, if we go to the southern part, the ethnic group is different. They live in warmer areas, and so and they have like very strong habits of going into the forest. And this type of knowledge you really have to know to be able to create like a specific health promotion program for that group. So my short answer is that there's no one answer to solve the problem of the whole Indonesia. So you really have to be specific on where you want to focus. Yeah. And for lymphatic filariasis, I'm not sure, June, do you have anything to share? Because like I said from the beginning of the lecture, he's the expert on LF in Indonesia.
Oke, tadi maaf pertanyaannya apa? Maaf.
Apa best practice sebenarnya Kak di luar negeri untuk kita bisa terapkan di Indonesia terkait pengembangan masyarakat untuk mengeliminasi filariasis di beberapa daerah?
Ya. Jadi sebenarnya ini tantangan juga ya, karena kan mungkin tadi saya juga meluruskan. Is it okay if I speak Indonesia?
Yeah.
Ya, jadi cuma meluruskan juga sebenarnya tadi kan si Ken Sensei ini cerita kalau misalnya cuma di Papua atau Sumba aja itu sebenarnya untuk daerah endemis filariasis di Indonesia itu hampir di setengahnya gitu. Jadi dari 514 kabupaten kota itu ada 236 yang endemis filariasis. Nah, namun penentuan endemisasi ini kan cuma dilihat dari tadi persentase microfilaria rate di satu desa, di dua desa di satu kabupaten tersebut gitu. Nah, di situ menjadi tantangan juga karena ketika kita nggak lihat sendiri kasusnya gitu, banyak orang yang nggak tahu kalau misalnya itu mesti ada tuh. Mungkin di sini juga nggak tahu kalau misalnya Jabodetabek sekalian Jakarta itu endemis juga gitu, kayak contohnya Depok, Bekasi, Tangerang, Bogor juga gitu. Jadi ketika itu orang nggak tahu kalau ternyata masih ada penyakit kaki gajah ya, dan itu banyak diketahui oleh orang kesehatan juga gitu. Nah, best practice-nya adalah kalau menurut saya harus ngeliat sih gitu, kalau harus diinformasikan kalau misalnya Indonesia ini masih ada kaki gajah gitu, dan mungkin Laos Laos, Kamboja, Thailand itu mereka sudah eliminasi filariasis. Sedangkan Indonesia ini belum. Kenapa? Kita nggak bisa melihat dari 236 itu 42-nya sudah eliminasi di Indonesia. Tapi kita satu kesatuan ya. Jadi sebelum 236 ini eliminasi, satu Indonesia ini belum bisa disebut eliminasi gitu. Nah, jadi yang menjadi pesan saya di sini adalah kita sebagai orang Indonesia di negara tropis yang salah satu penyakitnya itu adalah neglected tropical disease harusnya lebih tahu, lebih paham tentang penyakit antidiabetes itu sendiri. Itu salah satunya filariasis dan juga bisa mengedukasi ke masyarakat luas gitu. Walaupun cuma cerita aja kalau misalnya oh di Indonesia ini masih ada antidiabetes loh gitu. Dan kita bisa banyak belajar dari beberapa sosial media atau website yang menceritakan tentang kondisi dari NTDs itu sendiri, salah satunya filariasis gitu. Itu aja.
Thank you very much. You should give the lecture too. Thank you. So.
Okay, any other questions? Oh, maybe can you, yeah.
Hello. Okay. Good afternoon, Mr. Ken Ong. My name is Hana Odila. I am a graduate student from University of Indonesia, actually majoring in community of epidemiology. And
Sorry?
I'm a graduate student from Community of Epidemiology, and thank you for the presentations. My focus about neglected diseases and also malaria actually is about antibiotic resistance, which is now is public health concerning also, and we know that in Indonesia actually antibiotic resistance is also a public health emergency. How do you see about antibiotic resistance with neglected tropical diseases and also malaria? Actually, for Papua New Guinea people here in Indonesia also have a high incidence of antibiotic resistance itself. Also, my friends from Papua, they also usually consume antibiotic without thinking about is she actually infected by malaria or some kind of infected diseases. So how do you see about antibiotic resistance and also neglected diseases?
Yeah.
Thank you.
So thank you very much for your question. So my expertise is actually not in AMR, but I think I can answer your question. You know, if you look at the antimicrobial resistance, it really involves the whole system. What I'm trying to say is that the health system, the policy, the doctors, and also the patient themselves, right? And so if you really want to tackle that issue, I think it should start from the policy, because in countries like at least in the US or Japan, you cannot get antibiotics without prescription, and there's a strict rule for the doctors to be able to prescribe antibiotics. And so, you know, having that that policy, that kebijakan is very important as a first step. And the second step is you might also want to just to educate the doctors and also the pharmacy that, you know, just prescribing antibiotics or, you know, just for profit, that's not good. Because for malaria we used to have drug resistance, and one of the reason is that people just buy, you know, substandard drugs from the pharmacy when they do their self-treatment, and that could actually accelerate the formation of the drug resistant parasite. And so, you know, you want to get the local level, the local pharmacists involved. And again, you also need to educate the patients that, you know, if it's viral infection, antibiotics cannot do anything. And, you know, this might be difficult because, you know, at least in Laos, some people just feel that if they feel sick, they just have to eat something and they will feel better. But, you know, I think this really involves like proper health education and how do you do health promotion to get your message across. So it involves, I think, the whole system. Yeah.
Okay, thank you. I think there's another question. Yeah, go ahead.
Thank you. My name is Wemi. Good afternoon, everyone. And Mr. Ken. Yeah. I just want to know more about your study, the first disease, the foodborne disease. I'm just curious about how which maybe I lost the information. I lost the information about which kind of fish it is. I'm like, it is the specific fish that only appears in that countries or in that areas, or maybe we can find it in another regions in another countries too. And also how you mentioned about how you guys also see how they the preparation food it is. So the question is how they made it. I mean, like, they consume the raw fish, but and then in I also come from East Indonesia, and we also consume raw fish like that, but we put vinegar in it. So when how to say it, we resting the food, and then it will become cooked by itself by this the vinegar. So I just curious about how they consume it. Is it the same or not?
Yeah.
And also the questions about malaria itself, elimination malaria in that place, is it mean the same with elimination the plasmodium itself? So well, as we know in common, like the plasmodium will sleep in your liver, as you said before, and then wake up the dormant things itself, right? So the question is, the elimination is about the how to stop the transmission. So there is no new cases anymore, or the question is to eliminate all the cases and then prevent the death, the outcomes of the death.
Okay, so I
Yeah,
think you
thank
have
you.
three questions I need to process. So maybe if I remember correctly, the first question is about the geographical area of that disease. So that opisthorchisis is actually very specific to that greater Mekong subregion. So there's no reported cases from anywhere else in the world. So it's actually in that area. So that's why yeah, if you don't know it, that's fine, because it's very specific in that area. And the second question is about cooking raw fish, right? So you say you put vinegar and you assume that it's cooked. So actually, that's one of the messages that we tell the villagers in Laos. This is not cooking. They put like the lime juice, the lemon juice, and they think that it's cooked because it's acidic and the parasite will die. But the eggs of the parasite, they are actually very strong, so they can withstand, even though if you put lemon, it can still. So that's we tell them that's not cooking. Cooking is when you really heat the food and cook the food with heat, and that's when the eggs and the parasite will die. And your third question is about elimination. So when we say elimination by 2030, we mean that we get rid of all the parasites in the human and in the mosquitoes. But it's very difficult to say that there's no more malaria parasite in that area, right? So what we try to say in elimination by 2030 is that there is no more local transmission. There's no more reported malaria cases in that area. But that's a very difficult task to do. So yeah.
Okay, I think I see some other questions. Oh, in the back first. And then I will come back up here.
Okay, thank you for the lecture, Ken. Okay, I'm asking about, we have discussed about the climate change, right? And we know that the season can like berubah.
Can
Yes.
change.
Yeah, change. And then I'm curious about wait, can the animals like mosquitoes change their cycle as well? Because like maybe they can like adapt to the change of the climate. Is that
Yeah, so at least as far as I know, for mosquitoes are also very smart. They're very strong, so they can adapt very fast. So, with the change in temperature and the change in habitat, they want to survive. They want to reproduce. So, there's studies showing that the mosquitoes, they can adapt very, very fast. And one specific example is I can't remember from where, but the biting habit of the mosquitoes. Some mosquitoes, they prefer to bite I think maybe during daytime or nighttime, but because of the climate change and the movement of people, they found that this species actually adjusted their feeding habit to maybe a different time of the day. So they are able to adapt as well.
So it's possible for them to change their cycle of reproduction also.
I'm not sure about the reproductive cycle, but I I would assume that it's possible because they can adapt their feeding habits and they can adapt their habitats of breeding, and so that would affect the whole life cycle. Yeah.
Okay, thank you.
Okay, I think there are some questions up here.
Okay. Okay. I'm Sally. I'm Sally from Department of Epidemiology, Faculty of Public Health. So it might be similar to the previous question, but I would like to ask, considering the differences in population size and geographical conditions between Indonesia and Laos, how can Indonesia work toward eliminating malaria, especially if the climate change leads to malaria spreading into more endemic areas and increasing the transmission? Like, what strategies would work best for a country like Indonesia with its many islands and also diverse population? Thank you.
So for Indonesia, I do not have much experience, but I think for climate change, you really need to get everyone involved. I mean, like for malaria, because if there's climate change, then there would be, for example, extreme weather events, and extreme weather events like I showed in Pakistan, it could suddenly cause a spike in malaria cases after the flooding. And so if this were to happen in maybe a remote island in Indonesia, then the Ministry of Health alone will not be able to solve the problem. You might need like help from other ministry, like maybe even the army. And so I think for this issue to tackle climate change in the context of malaria, you really need to get the whole government involved, because for countries like Indonesia, I think one ministry alone cannot work by themselves. It's very different from Laos, because Laos is a landlocked country, and the condition and the context is very different from Indonesia. So my short answer is to get everyone involved to be prepared to tackle this issue. Yeah.
Thank you for the opportunity. I am Ines. I'm majoring in public health, specifically in epidemiology. We are actually her student in class. Yeah. Yeah. I was wondering. Lately, many people, influencers from Indonesia, are traveling to endemic countries such as Thailand, Laos, and other countries in Southeast Asia. They go to extreme places to get some content on Instagram or just get a new experience. I was wondering, what do you think about the risk of people who have received prophylaxis as a prevention against NTDs and climate change when they are traveling? Since climate change is a wide range of sectoral problem. Thank you.
You mean prophylaxis?
Yes.
For malaria?
Prophylaxis.
Is it like
prophylaxis? It's like a vaccine.
Prevention, right?
Yes, yes, prevention.
So your question is about prophylaxis and climate change, or?
No, it's the risk for getting the NTDs, malaria.
Oh, okay.
Yeah.
So if you take prophylaxis, that means you are somehow not 100% protected from the disease. But I think it really depends on that individual, just because you have the prophylaxis and just because you have like the vaccine for any disease, it doesn't make you 100% immune. You can still get it, but maybe the, clinical presentations might not be as worse as those who are not, immune or getting the prophylaxis. And to answer your question, um, I think you really need to be aware of where you go. And of course, you have to take the prophylaxis, but you also have to take like the, steps to protect yourself from getting that disease. Like, for example, if I go to a malaria endemic area, I would make sure that I'm properly covered and I have like mosquito repellents, even though I take the malaria chemoprophylaxis. And so it just having the prophylaxis alone doesn't protect you 100%. You need to be aware of where you go and take the proper steps to protect yourself too. Yeah.
Okay, thank you so much.
Yeah. Okay.
Any other question? Oh.
So I'm Zahra from undergraduate student of Department of Epidemiology. So I would like to ask that, as you've mentioned before, that when it comes to public health, we can't just look at the numbers, but we have also to look at the information. So that's why we have to take like field epidemiology and also the qualitative and the mixed methods in the research. But especially for me, for the undergraduate students that don't have any further knowledge for to make sure that the information that we get from the community itself, that is it how we can make sure is it connected to the disease or something, or because maybe when it comes to the new emerging disease, or yeah, that kind of thing.
You mean information from the villages or the what? I'm sorry, can you rephrase your question?
Yeah, maybe when it comes to there's information that we got, but we don't know that is it connected to the disease or is it a risk factors of it that we still don't sure about that. But how can we make sure that that things is actually connected to the disease?
So the information from where?
From the villages, yeah.
From the villages.
Yeah.
Okay, so I would say that, so when you talk about community involvement, it's not just like one time where you go to the village once and then you ask and then you leave. So for the project, I've been involved since 2015 to 2023. So we go back and forth, and to really understand the context of the village. And when we talk to the villagers, when they tell us something, we take the information and then we discuss with our colleagues and try to understand what is this information. And if we're not sure, we go back to the villagers again. So, like community involvement is really, it takes time, and it's just not like just one time interaction. So to answer your question, you might need to spend longer time, in the village just to ask them questions, whether or not this is what you meant, and talk to your professors or your advisors to see if the information that you get makes sense. Yeah.
All right, thank you very much. I think that is all the questions because we are about to finish this the lecture today. If anyone has burning question, you can ask him afterwards. But let me just say thank you, Dr. Ken Ong, for giving the lecture today. We apologize for the technical issues, but I'm glad that everyone managed to ask a lot of questions. And I think this is very funny actually, because neglected tropical disease is very prevalent in Indonesia, but we don't get to discuss a lot of this topic in the university, I think. So I think it's also a feedback to our faculty that maybe we should be discussing more of this in the future. Anyway, is Prof. Astri still here? Maybe for souvenir, to give a souvenir, and we'll take a picture afterwards. So Prof. Asli, please come forward. And Yeah. Okay, thank you very much. And with that, I'll just close the lecture for today, and then all of us can take a picture together. Right, thank you very much.